Treatment of cholera, as we mentioned, the mainstay is rehydration. So aggressive volume repletion is the mainstay of management for cholera, as rapid correction of hypovolemia and metabolic acidosis and the prevention of hypokalemia are the most important targets. If the patient is conscious, let the patient to drink water freely. If the patient is weak or unconscious, comatose, or unable to drink, this fluid to be given either parenterally or through nasogastric tube. The infusion should be rapid until blood pressure is normal and pulse is strong. The adequacy of hydration of cholera is confirmed by correction of blood pressure and the correction of pulse rate and volume, and regain the skin temperature and good urine output. Here there is a good note: don't use plasma volume expansion instead of water and electrolyte. My aim in the management is to restore the blood volume with the isotonic saline and electrolytes, not to maintain blood pressure through vasoconstriction, not to maintain oncotic pressure through administration of plasma or dextran. So again and again, the mainstay of treatment is restoration of blood volume through administration of isotonic saline and electrolyte solution, and also correction of potassium to be given. There is oral rehydration solution recommended by the WHO containing glucose, sodium chloride, sodium citrate, and potassium chloride. This should be administered either orally or through nasogastric tube in comatose or weak patients. What about the antibiotics in patients with cholera? Antibiotics can shorten the duration of the diarrhea, reduce the volume of the stool losses, and lessen the duration of Vibrio cholera shedding. We suggest antibiotics for patients who have moderate to severe volume depletion in the setting of suspected or documented cholera, or suspected or documented cholera in the setting of an epidemic. So, administration of antibiotic to be given to moderate and severe cases and during epidemic. Antibiotics are usually given orally after initial rehydration and when the patient is no longer vomiting. So if the patient stops vomiting, administrate antibiotics. The antibiotic option for cholera include macrolides, fluoroquinolones, and tetracycline. The choice between them should be based on availability in these areas of cholera infection and the local resistance pattern to antibiotics. Tetracycline are effective against Vibrio cholera, but some resistance to tetracycline and doxycycline is common. So the alternative to be used as fluoroquinolones and macrolides, either ciprofloxacin, erythromycin, azithromycin. This table represents the antibiotic therapy: tetracycline, doxycycline, norfloxacin as a part of fluoroquinolones, and these are administered for adults only. Children can take erythromycin or trimethoprim sulfamethoxazole. Nutrition and vitamins in patients of cholera. Adequate nutrition is important to prevent malnutrition and facilitate recovery of normal gastrointestinal function. Eating should be started very early once dehydration is corrected, and the breastfeeding of infants should be encouraged in conjunction with oral rehydration solution. In acute diarrhea, supplementation with zinc and vitamin A may be used as important. What about the prognosis of cholera? More than 50% fatality rate in untreated severe cases. This will be reduced to be less than 1% death rate inadequately treated patient. What about the treatment? As we mentioned, the mainstay treatment is diagnosis even on suspicions, early administration of rehydration through isotonic saline and electrolyte resubstitution. Thank you.